welcome everyone to Operation to Save Lives, the intersection of law enforcement and public health. My name is Scott Allen, the Chief Operating Officer of Operation to Save Lives and retired Police Chief from East Bridgewater, Massachusetts. With me today here we have retired Arlington, Mass. Police Chief Fred Ryan and Dr. Nathaniel Horwitz-Willis, PhD doctor and a public health leader, military veteran, jack of all trades as part of our panel here today. And really, this is going to be an informal discussion that we're talking about a topic area that is so critically important in our nation right now. And it's talking about improving the health and social issues of our society collaboratively with public safety and public health. And with that, I want to introduce and give Dr. Nate a couple minutes to introduce himself to the team.
Yeah, hey, thank you, Scott. I really appreciate it. And I should have told you before, and I'm sorry, but we don't call ourselves PhDs, we call ourselves DRPHs, and it's very explicit because we're doctors of public health. And being a doctor of public health, we are essentially tasked with being somewhat almost a jack of all trades. My specialty is in public health leadership with emphasis in policy and looking at epidemiological and biostatistical methods to achieve particular health outcomes that are hard to get at, that we've been struggling with, since almost the existence of our history, as a nation called the United States. But I've worked in, leadership roles as the director of public health in the largest municipality by land area, that is in Massachusetts, in the town of Plymouth. I've also done a lot of work in public health as a public health officer in the U.S. Air Force on the active and on the guard side. And then I do advising and consulting work with municipalities and other institutions, so we can look at how to address public health institutional issues of concern. And I suppose that brings us to why we're working together. And I'm very proud to be here as we have done a lot of good groundbreaking work before in the areas of equity, opioid, substance use disorder, and just looking at policing as an institution for better outcomes on both the mental health and also on the disease transmission side. So thank you for having me.
Well, thanks there. And Nate, I did leave out, so you and I, partnered together through our work in Plymouth County. And, it was just, it's been an honor and pleasure to be able to partner with you hand in hand along these years, which leads me into our second guest here, Chief Fred Ryan, who, is as innovative as a chief has been in Massachusetts and across the country with behavioral health, engaging in law enforcement. Fred, in 2008, your department embedded a mental health clinician. Is that correct?
Yes. Good morning, gentlemen, and thank you for having me. Back in 2008, Scott, when I was police chief in Arlington, Massachusetts, in the Metro Boston area, we started to look at our data and follow, what was driving our calls for service and what were the outcomes. Really try to look at qualitative approach to providing police services. And as we really drilled down on that data, we recognized that recorded incidents of calls for service that had a mental health or addiction element to them were about right around 11% of our calls. Now we know that many more calls, there wasn't the appropriate drop-down menu to capture what really occurred. So we knew that was the floor rather than the ceiling. And we started to look at and partner with our public health agency in our community at sort of, how we might provide more sophisticated police services to this population. And as we began to study that, it became, to me, a kid who grew up in the projects in the community that I ultimately became the police chief in, it became my passion in terms of leading our law enforcement agency at serving that underrepresented population of people that really were suffering with disease states that were being criminalized. And so from that was born our program to embed mental health clinicians into the police department, co-responding alongside police officers to provide better care for this population and guide them to access to evidence-based treatment options that really were unavailable to people on the lower end of the socioeconomic spectrum and people of color. And so back in 08, we sort of This idea was conceived in '09. We actually got the funding to move forward. And a lot of my peers in law enforcement thought that I was the one that needed mental health services for doing this. And as you know now, it has become quite common. And then fast forward to 2015, when the Police Assisted Addiction Recovery Initiative was founded up in Gloucester. We were the first law enforcement agency to sign on and to provide a proactive overdose follow-up, outreach visits, and resources to people who were in the grips of addiction and opioid use disorder, and opening doors, evidence-based treatment for those folks as well. So it's been rewarding work. I do worry about the narrative of today and what's going on nationally, because that intersection between public health and public safety is right where the sweet spot where significant and meaningful change for this population can be made. And I hope that we don't have a setback as a result of what's going on nationally.
And I apologize. I mean, obviously the PARI, you've been a leader nationally, Fred, leading, the 3 annual summits, 2 in Boston and 1 in DC for PARI, who's been at the front lines of this, proactive deflection, pre-arrest diversion. But really what's evolved to is this, to me, I call it this integrated behavioral health model with law enforcement and public safety working together. Nate, with your experience, your diverse experience here across the country, what's the public health perspective where law enforcement seat at the table? I mean, where do you see the fit? Is there a fit there together? Should it be integrated, that partnership? And then if so, what does it look like?
Yeah, absolutely. When we look at the history of public health and public safety, they have operated really like in distinct silos, right? Even the use of the word police isolates, what public safety is supposed to do. And it's not by virtue of the police doing it. It's the perception and how we cultivate that. So as public health professionals, we're like, hey, look, you have a component just like we do. You're designed and you're here to keep the public safe. And with public health not working with public safety, right, with law enforcement, you create these divisions and you start to create these social situations in which we cannot heal, in the avenue of racism, mental health, even the transmission of disease. So in my own experiences, particularly being in the military, it's been very fruitful to have a relationship, with those people. We call them security forces, or we call them, our safety personnel. We've had this relationship when we've had, issues dealing with things such as tuberculosis or dealing with any other type of an emergency, disaster proclamation, humanitarian efforts. You have to work close and you have to, be side by side. I've seen other effective community policing models across the nation, to where, hey, public safety will reach out directly to public health and say, hey, this is the situation. We need your help, come with us, So I've seen that work in California, if I want to be explicit. And they've had a seat at the table to talk about public safety efforts, to talk about perceptions. So that's the key thing, is that once you understand where each other are coming from, what goal you're trying to reach, you're going to be that much more effective. So when I say you, meaning when a person in public health makes a decision, it doesn't have law enforcement's voice at the table to inform some of the outlying consequences. And then if law enforcement isn't listening to public health about some of the other consequences in terms of health outcomes, you're going to diverge. You're not going to get to that goal, right? So it's more even than just sitting at the table, or more than just a fit. It's more about interweaving. So as Fred mentioned about some of his work, he's been very effective in it before anyone talked about this on such a grand scale, right? We know that there's been publications published about being effective with community policing. It's just more so at the scale, right? How can we achieve this at scale? But I think when you have dynamic public health leaders who understand how to use the science and to be objective and to be inclusive and equitable of any profession, that's where you achieve the most. And then you don't even have that much of a hard, heavy lift to do it, because in my interactions with law enforcement, they're willing to listen. That's never the issue. You sit them down, you get them at the table, they're willing to listen. What happens is when you tell them what to do, that's when you get into trouble. And that is by design, because when you're in a situation, just like, in my own experience, being in military, you are taught to act on command, and it's for a reason, to get the best desirable outcome. Because of a situation. And that's the same thing when you're in a disease situation in public health. When you're doing an outbreak investigation, you have to act on command to prevent further disease outbreak. But now when you have all these different intersections, you have these different nuances, it is important to capture that perspective to address those different nuances. So that way, nothing is miscommunicated, nothing is misconstrued, and then you're going to have less of an error rate for any type of incident or mistakes that are going to lead to any type of atrocity or bad incident. And that speaks to the heart of the matter of addressing situations such as racism.
Fred, to that point, how did you get that, building the trust in the community, but also the building the trust with your public health counterparts, colleagues at the leadership level, to be able to have this collaborative, program, evolving?
Yeah, a great question, Scott. And really it's about, humility and going to the table with that data and bringing in public health professionals and asking for help. We approached it from listen, we're failing this population and our overdose rate is skyrocketing. And we have the names of the population of people who have experienced a previous overdose in our database. We know who they are. Yet nobody from public health or public safety was doing anything proactively to prepare this population to survive their next overdose, no differently than we did years ago when we changed the paradigm around providing services to those suffering with or in an abusive domestic violence relationship. Do that survival planning with this known population of people that are suffering with substance use disorder, so that they can indeed survive their next overdose, and then in hopes that they get into long-term recovery and thrive in life, right? And so it was that humility, I think, Scott, of us going to public health saying, we need your help. We're failing. And if we were losing pedestrians on Massachusetts Avenue at the rate that we were losing people to opioid overdose, my phone would be ringing off the hook. But because of the stigma associated with addiction and the unwillingness of really political leadership or other executives in government to embrace people actively in addiction and really propping up those who are in recovery, we decided to exercise our leadership as law enforcement executives and embrace that community, work with public health, work with the addiction community, and start getting this thing right, rather than sitting around and waiting for the 911 line to ring and going out with the coroner to clean up the mess. So short answer is, it was being humble about our failures and seeking the help of others that really was the energy that drove this engine.
And as we're talking here, the kind of the bullet points in my head that come up is, it talks about those meaningful partnerships, not only at the leadership level, but then at the front lines with, we talk public safety, public health, that includes a lot of different, partner organizations, but we're also talking, and I know in Plymouth County, and then what we've done with our Operation to Save Lives model is, it's that collaboration. Relationships build partnerships that lead to true collaboration. And back to your initial opening, Fred, where I get concerned right now is that, there is definitely a reaction across the nation, across the world, that, law enforcement, really should not be involved in this public, health arena, if you will. But, we can collectively, I just feel like we can accomplish so much more. And we've shown that through these different initiatives over the past, more so about 5 years or so, really, where public health and public safety have really intersected. That I just feel like, I'm concerned too, that there's going to be this step back. But again, though, if we have meaningful relationships and we take the expert advice, data-driven strategies, outcomes. I'm thinking out loud that, you know, what we can do to promote that collectively with leaders from the public safety and public health is really what needs to happen at this time where we're all, concerned about where our country is right now.
Yeah, excellent points. And you know, with the Plymouth County model, and adding the data and the science to the motives of well-intended people is what has good outcomes for people in a disparate healthcare system, and a system that, you know, listen, when we started our work around opioid overdose follow-ups, we learned very quickly that many emergency departments in hospitals in metropolitan Boston neither had the desire or capacity to treat overdose patients. They just, you know, once they were stabilized, they wanted them out of their emergency room. And so we stepped back and said, you know, we took an oath to protect people's lives. And we don't get to assign value to people's lives. You know, that person suffering with opioid addiction, his or her life has just as much value as a person living in a mansion in your community. And so when you bring that mindset to this work, and you set aside, you know, this value system and this socioeconomic system and all the disparities that come and stigma that comes with addiction-related disease states, and you set that aside and partner with other stakeholders, the outcomes are simply extraordinary in terms of saving lives. But as I said earlier, it's not only about, you know, survival, right? We want people to survive, but we also want to move them into long-term recovery and thrive in life, and be able to lead healthy lifestyles and meaningful lives. And that's, you know, incredibly rewarding work. And the outcome in terms of building trust in the community, you know, although a value-added benefit, is simply extraordinary. You know, when people saw that the police came to the table and admitted failure, asked for help, implemented good programming and partnerships that resulted in good outcomes, you know, just built trust, and it's incredibly important.
Yeah, if I may add on to that, you know, that those are very good points, Fred, and especially when you said earlier, you realize, you know, hey, we're failing, you know, this community, you know, that was composed of, you know, Black and brown lives, and then you guys, you know, you went and you righted the ship because you're like, wait a minute, we're here to save all the lives, you know, we value all lives, and I think that's what's central to the whole messaging of Black and brown lives matter. It's like, no, we get it. We get that. So we value all lives. So yes, no problem, no question. Yes, it matters. And that's the thing I think that's going to be important about talking about this collaboration in our strategies in the future webinars, to say that, look, this is a data-informed decision to help you to see that why we want to save all lives. If someone is marginalized, yes, let's acknowledge it. But you know what? All lives do matter, right? There's no political messaging behind that. It's the facts that we're showing you, and this is why it matters as an institution of public safety to go out there for anyone that's facing any kind of issue in this intersection between public health and public safety. And the other thing that came to light to me just the other day, I was talking with the student who pointed out to me, in a state such as Massachusetts, there is no behavioral health commission that is saying that, look, we recognize this proportion of individuals who are suffering from behavioral health issue. This is the intersection between public health and public safety. How do we address this? That does not exist. So with this type of a collaboration between public health and public safety, we are in effect somewhat serving in that role to assist police departments to be innovative, to assist healthcare institutions to address saving those lives. And yes, even in working it kind of in a business model capacity for that, because healthcare institutions will have a better bottom line with this type of a service. Police institutions will achieve better benchmarks, and there's going to be improved efficiency. So it is a win-win. No one loses in this situation. So I'm looking forward to us, you know, to really look at, you know, getting at the heart of the matter, to saving lives in this operation, if I may say that.
And Nate, you hit on it. I mean, we know that there are racial disparities, you know, in the criminal justice system. in the treatment, in the medical, mental health, substance use disorder. I mean, there are publication studies out there. So the way I look at this collaboration is the ability to make sure that those underserved, marginalized populations that don't receive the services they should. To me, this is the perfect opportunity to forge even a stronger bond and relationship so that we can learn from one another to make sure that we're serving all populations. And I really think that, to me, I'm trying to look at this as a part of, hey, this is where we can come together and then, even strengthen, more of that innovative work that collectively both, sectors have done over these last 5 years together. But, there's just so much more that we can do. So Nate, you did talk about and opened up, we're looking to, and we'll be hosting a live webinar to talk about, this intersection of law enforcement and public health later here in August. And you want to just kind of give a preview of what we're looking to accomplish with that?
Yeah, absolutely. The preview is to, yes, talk about public health, to talk about equity. We'll have some people from, we'll have a special guest from the public health side to talk about equity in communities, and the importance of having, community policing and what does that mean, in Black and Brown communities, and also just in all of our communities at large. Number one, and talking about the associated health outcomes with that, because in the age of COVID, we're talking about, just that. However, it's more important to talk about the mental health aspect associated with that long term. So we'll even dive into that and talking also about the effective strategies, that we've had with policing and public health here in the very recent past. And I'll be actually having one of my own friends who's in policing that's, had some of his work, in Austin, Texas, and it had some success in his work, in that city. So I'm very much looking forward to it. We'll even touch on some hot button, topics such as qualified immunity and what does that mean as a public health expert when you have someone at the table from law enforcement, and then talking about anything and everything else, by our beloved panelists, by beloved hosts, of our panel, Rachel Oliver, who will be moderating that. So I'm looking forward to that.
Great, and we're looking to do that in August. And Fred, we're looking to have you, with your leadership and your voice here on the national level, really, help us forge these partnerships. Do you anything in closing that Fred, just to close this out for our preview show here?
Right. I just want to thank each of you gentlemen for the conversation today and the conversations we've had along the way. These are certainly challenging times, and I think that our August event will help leaders in public health and public safety continue to forge that bond between our respective disciplines and move the dial forward, not for us as professionals, but for the people that receive our services. That's what drives these programs. That's what I think drives each of us as individual professionals in this space. And we've got to think about good outcomes for those people in the grips of addiction and serious mental illness. And I look forward to this conversation. It will be exciting.
Well, thank you to you both for your time and your dedication, your innovation, and your willingness to help these populations that are so desperately in need. We're looking forward to the August date, which we'll follow up with the actual date and time. And looking forward to. In the meantime, if there's anyone can reach out and see what Operation Save Lives, what we offer for our program services on our website, on our LinkedIn page, and then we can connect you with Dr. Nate and his advocacy and lelywap.org. And just look forward to August and to continue to collaborate with you. And thank you both.
Thanks.
Thank you. Have a good day.